Triad Today. I always like it when we can get a special guest from UNCG, my alma mater, although they don't claim me. And next to me is the very lovely Dr. Carrie Hill. She's a clinical assistant professor and director of the RN-BSN program. I'm going to find out what that means in a minute at UNCG School of Nursing. Welcome, Doc. Good to see you.
Great to be here. Thank you.
What does, I'm going to play ignorant because I don't have to pretend. I am. RN-BSN, what does that mean?
Well, that means that a lot of people have heard of a registered nurse.
Right.
And that's an RN. And there's many different ways to become an RN. You can go to a diploma program, you can go to an associate's program, or you can get a bachelor's degree.
Right.
And the RN-BSN program is tailored specifically for those nurses out there who have a diploma or an associate's degree and who want to continue their education and get their bachelor's degree.
Okay. Now, what is your role in this program in helping folks?
Well, so I just became the director of the program as of January 1st. And so I'm the director of the program. I guess I'm in charge of making sure that we're doing everything right.
And I know you are. I happen to know you are. But now, who are your typical students?
So we don't have any typical students, I'll tell you that. We have nurses, so those are our typical students, but they can be straight out of their associate's degree program. They can be 21, 22 years old.
Even older?
And we have some that are in their 60s.
Wow.
Coming back to school to get their bachelor's degree.
I like that. That's my group in the 60s. And they, seriously, though, they're coming in to come
Absolutely.
in to get the degree.
Yep.
And now I heard that you're also involved with the Moss Street Partnership School. And we featured that some time ago on the show. It's a great partnership, the elementary school there. Tell us your role with that.
So the School of Nursing, we began our involvement with Moss Street Partnership School this past summer, and I took a group of senior nursing students, so those were the students that are just getting ready to graduate here in a couple months in May, and as part of their population health course, we developed a clinical site there, and so I took students there every week to see what we could do to help out the elementary school.
Isn't that great? You're also a pediatric nurse, so I want to ask you this. Give me a couple examples of things that parents can do to ensure the health and safety of their children these days.
Well, a lot of that depends on the developmental level of the child.
Sure.
And so certainly taking care of an infant is a lot different than taking care of a 10-year-old or a 15-year-old. And so a lot of it depends on how old the child is. You know, the things that you watch out for an infant are a lot different than the things that you would watch out for a 10-year-old.
Right.
But you know, we're coming into flu season and all the big respiratory viruses, and so one of the biggest things that you can do that we preach to our nurses is wash your hands.
Oh yeah.
We can't stress enough how much washing your hands is so important, or using the Purell, the hand sanitizer. It's very, very important.
Absolutely, and because little kids go to school with other little kids and they just love to swap flu germs, don't they?
They do, and we always say that the way that a lot of smaller children and toddlers explore their world is through their mouth.
Yeah.
And so anything that they see, they pick up and they immediately put it in their mouth.
Man, that's me and chocolate cake. That's why I'm overweight. Now, before time runs out, what led you to want to do this career in healthcare and nursing?
It wasn't my original career. My original career was actually doing benchtop research for vaccine companies, and I wanted to actually help and take care of people directly rather than work in a lab.
I think that's great.
And so I went back to school and became a nurse, and then just never stopped from there.
So the bug sort of got in you about when? How many years ago?
I've been a nurse for 15 years.
Wow.
And really, if I'm being honest, the one reason that I did
it was
because...
we don't like that on this show.
because my sister told me that I probably wouldn't become a good nurse, and so I wanted to do it
Well, boo on her, because you have, and we're so glad you did. Up on screen before time runs out, nursing.uncg.edu is the specific website, which I hope you'll go to. For the radio listening audience, again, nursing.uncg.edu, and the basic website for the university, UNCG.edu. Dr. Carrie Hill, thanks for doing this.
Thank you.
Will you come back and see us sometime?
Absolutely.
All right. We'll be right back.